back. A lot of expectant parents are feeling especially anxious during this coronavirus outbreak, and that's because in some hospitals, in an effort to promote caution and safety, partners are now being banned from the delivery room. Here in New York, it sparked a change.org petition with more than 250,000 signatures calling on officials to step in and reverse that decision. So we're going to answer your questions about the topic in collaboration with Facebook. Joining us is NBC medical correspondent Dr. John Torres. Good morning, Dr. John. How are you?
Good morning, Hoda. I'm doing great. How are you doing?
We're great. Well, so first question comes to us from Rachel via Facebook. Let's take a look.
Hi, my name is Rachel. I'm from Mundelein, Illinois. I was wondering, how likely is it that other hospitals around the country will be like New York City and not even allow one support person? And how long do we anticipate that these restrictions will be in place?
And Hoda, what I think you're seeing happening here is a lot of hospitals are doing this in the hot spots of the country, the places where they're the epicenters of this outbreak right now. And the reason they're doing it is it's a decision that they're not taking lightly. They're not doing just because they want to get people out of the hospital. They're doing it because they want to protect the mother and the baby. And as a father of two, I can tell you there was nothing more important than being there for the birth of my children. But at the same time, there's nothing more important than the health of the mother and the health of the child. And so they're looking at that. And there's no easy decision here because, again, it's important to have the partner in there to help out with the baby and the birthing and the mom, but it's also very important, and probably even more so important, to make sure that mother and the baby are as healthy as possible. I think you're not going to see it spread across the country unless there's more hot spots around the country, and hopefully it only lasts a few weeks here because we need to make sure this is under control, and if everybody does their part, we'll get it easier, we'll get it under control a lot quicker, and that means more of these hospitals won't have to go to this step.
Well, also, I guess there's such a shortage of PPE, of that protective gear, the idea, I guess, of giving it to a father to go into the delivery room when you have doctors reusing stuff over and over again, maybe doesn't seem like a great use of resources for some. Okay, so Rose's question is this. Wouldn't some health experts argue that a partner can provide emotional support and additional physical support, such as alerting nurses when something is wrong? And that is a great point.
And Hoda, I think it's a fantastic point, and I don't think any expert would argue that it's not good to have somebody there as support, being a partner, a doula, whoever, as support for the mother as she's giving birth to the child. But at the same time, the same experts would say even more importantly is to make sure that health is maintained. And we're talking the health of the staff, the health of the mother, the health of the baby, probably the most important factor in all of this. And so again, I don't think anybody would say, it's not important to have them there, and this is a very temporary measure. This is unprecedented in our time. We've never gone through something like this. And so we're doing these things, we're learning as we go, and part of that process is, again, making sure everybody is safe and healthy, and then hopefully it's very, very short-term lived here. It's not happening very long, just for a few weeks, and we get over this and they can get back to normalcy.
Yeah, the idea of being all alone in the delivery room without your spouse or significant other seems like almost just too much to bear. Here's a question from Jordan on Facebook. Take a look.
What is the procedure for labor and delivery if between now and my due date in 28 days, I become infected with the coronavirus? Will mothers and babies be separated during the postpartum period for any reason?
Wow, that's a good question.
That's a great question. It's a very difficult one because what they're recommending, I've gotten guidelines from some hospitals, and what the American Colleges of Obstetrics and Gynecologists are recommending, that if the mother is COVID-19 positive, if she has coronavirus, then they recommend separating her and the baby at birth just temporarily to test the baby, make sure the baby doesn't have it, and make sure the mother recovers from it, because the one thing they don't want it to do is pass on to the child, because we do know that children can be at risk of this, and the younger, the worse it can be. And so they're trying to protect that baby. So again, it's nothing anybody wants to have happen, but they might have to separate them temporarily just to make sure that the baby is okay.
Any cases we know of so far, Dr. John, of babies having the coronavirus, newborn babies?
Not here. There have been some cases around the world of them having it, but not here in particular in the U.S. So we'll keep our fingers crossed that doesn't happen. And again, taking these steps, taking these measures is one way to make sure that doesn't happen going forward.
Okay, we got one last question from Ashley. She wants to know, will there even be a safe and sterile place for my C-section, knowing so many adjustments have been made to make room for coronavirus patients?
Yeah, I think that's one thing you can rely on, that the operating room where they're doing the C-section is a sterile environment. Everybody has their PPE on. They're taking extra precautions to make sure that nobody's in there that has COVID-19. And so it's a very safe environment to have the child in. And so if you are scheduled for a C-section, or if they recommend a C-section, I think that's one of the few things you don't have to worry about in these times that we're having right now.
All right. Dr. Torres, we appreciate you. Thank you.